Here is your station.
Okay.
Right. So if you're ready, yes, I'll start the timer. Yes. So if you've read and understood considering it critical care scenario, please tell me how would you manage this patient?
As a crisp protocol,
Very good.
checking ABC, checking airway and the
Yes.
breathing.
Yes.
Put two pour large cannula to give him fluid and
Yes.
take labs and urine catheter
Yes. How
and doing
frequently would you be monitoring this patient?
vital sign, blood pressure, heart rate, and maybe capillary fill and urine output,
Yes.
and maybe doing some imaging like ultrasound for his abdomen.
Okay. How frequently are you going to observe this, follow up this patient?
Every hour,
15 minutes. No. Patient also
15
has 50
what?
minutes. Yes. Where would you manage this patient?
And I will do ECG for this patient too.
Yes, ECG. Yes, patient is
For
already having
yes,
atrial fibrillation
or
and
maybe take
taking.
INR measurement to
Okay. Would you
for
let the patient continue with the warfarin or you'll do some intervention?
do bridging. Give him heparin IV.
Heparin as an
Injection
anticoagulant.
heparin injection.
Okay. And what else?
What? Yes.
Heparin as a anticoagulant. Then what else?
Anticoagulant for AF, or amiodarone,
Okay. And what do you
and
think?
cardiologist. What? I think for what?
Patient has duodenal perforation and it's 5 post-op day
Mm,
for
mm.
decompression. So what do you think might has happened to the patient?
Maybe peritonitis after perforation ulcer.
Okay.
Maybe he has septic shock.
Okay.
Maybe he has accumulation of from leakage of site of surgery.
Yes. Yes.
Hypovolemic shock.
Yes. Right. Yes.
Mm.
Hypovolemic shock as well. Very
Mm.
good. Yes. How would you determine what investigations would you carry out to confirm your diagnosis?
Complete blood count.
Yes.
Maybe chest X-ray and abdomen X-ray.
Okay.
Abdomen ultrasound.
Yes.
I do CRP,
Yes.
C-reactive protein, yes, and urine analysis. What else? Yeah, renal function and electrolytes.
Okay. And how would
Mm.
you manage the patient? You've done the first aid, you've done the crisp management, and then
Yes, maybe you need another exploration his
exploratory.
abdomen.
Yes.
Yes.
How would you take care of the nutrition of this patient?
MBO. I will give
Okay.
him
And
fluid, Hartmann
okay.
and crystalloid, Hartmann and Ringer lactate.
Ringer
Uh,
lactate. Okay. What are the constituents of ringer lactate?
constitutors, sodium and potassium and
Yes. How
lactate.
much?
I don't remember.
Okay.
85 maybe.
Mm,
No, I don't remember.
no, you have to
Mhm.
twice that.
Check that.
Okay. Yes. Please tell me how would you calculate how much kilocalories you need to give to this patient?
Mm, no, maybe back for
It's according to the body weight, and you
yes.
give 30 kilocalories per kg
Okay.
to 2000 kilocalories per kg, right?
Okay.
And this is like post-op patient. It has sepsis as well. So maybe you would have to increase the
Antibiotics. Give
no,
antibiotics. What?
kilocalories you have to increase
Okay.
between 40 to 45 kilocalories per kg
40 to 45.
because of it's post-op and there is a possibility of sepsis as well, or there is
Illness,
yeah.
Mm.
Okay, right. What else would you take care of, or what else would you keep in your mind when it comes to atrial fibrillation? With regard to atrial fibrillation,
hypokalemia.
okay, yes. How would you take care of that?
I will give him hyperkalemia. I will treat hyperkalemia.
Yes. How would you treat hyperkalemia?
Give him calcium gluconate and the beta blocker. If pH less than 6, or if there is acidosis or high potassium, maybe he need the dialysis.
Yes, if it does not manages with conservative management. Okay, one more thing. If you'll do ABGs, arterial blood gases, what do you expect to see?
Acidosis, metabolic acidosis.
Okay, how would you take care of that?
Metabolic acidosis.
Yes,
Yeah.
because when there is hyperkalemia, there is metabolic acidosis, then one thing you'll do cardiac monitoring.
Cardiac monitoring and give him bicarbonate as bicarbonate.
Okay, bicarbonate to correct
Yeah.
metabolic acidosis, but then for okay, hyperkalemia, you can even give calcium gluconate or calcium
Yeah,
chloride.
I saw that. Yeah.
All right, okay.
Mhm.
And how would you prevent the infection? What measures would you take?
Give him antibiotic.
Okay, but before that, hand hygiene, use skin antiseptics, and
Mm, what?
you'll use mask, caps, all the precautions.
Okay.
Yes. All right. Anything else you would do?
Blood culture,
Yes. And blood.
urine analysis,
Yes. Okay.
and give him antibiotic due to the hospital protocol.
According to the trust guidelines. Yes. Okay. Anything else you have to keep it in your mind. If it is septic shock, how would you take care of septic shock?
Conservative management. Give him
Okay.
fluid.
Yes.
And treat the underlying cause by antibiotic. And do complete analysis for him.
Yes.
Monitoring by urine catheter.
Yes.
What?
All right. So you'll be doing okay, there could be peritonitis. So yes, you
Yes.
said you'll be doing ECG. How would
Yes.
you confirm that patient has atrial fibrillation?
Absent P wave and
Very good.
ectopic bizarre QRS.
Okay, there can be many causes of atrial fibrillation, right? If
Mm.
I ask you to classify them into cardiac, pulmonary, and others, kindly give the examples.
Cardiac causes of atrial
Atrial
fibrillation.
fibrillation, yes.
Heart failure.
All right, and
Uh, mm, mm, mm,
myocardial infarction,
myocardial infarction.
cardiomyopathy, endocarditis. Okay, pulmonary causes of atrial fibrillation.
Pulmonary hypertension.
Okay, and pneumonia.
Pulmonary embolism. What?
Yes, pneumonia, septic causes.
Pneumonia. Yes.
Okay, what other causes can lead to
Hyperkalemia, electrolyte disturbance.
yes,
Maybe
hypoxia, even
yes,
electrolyte.
hypothermia and hypothermia.
Very good. Yes, excellent. So what I would want you to tell me, right, you have managed that. You've done the surgical problem with, okay, what are the surgical problems that can arise with atrial fibrillation? As a surgeon, you should know those.
A complication for this surgery or in
Yes,
general?
yes, yes,
Oh.
because you would have to reopen and
Maybe peritonitis infection after
no,
surgery.
no.
Maybe what? DVT?
No. This person has atrial fibrillation, and
Okay.
once you'll put the patient in anesthesia again, so there could be because
Embolism for in the
stroke. Yes,
yeah,
very good,
stroke.
very good.
Yeah, multiple
Yes,
embolism. Yeah.
yes,
Uh,
and
uh, but, stroke in brain and pulmonary embolism
yes, and then there could even be a result into heart failure. There could even
and
result in
respiratory failure.
stress of surgery can cause hypotension, and they could lead like these are the causes of like these are the risk factors of
Shock.
yes,
What?
because of the atrial fibrillation.
Mm-hmm.
All right, good. And if you'll give for the atrial fibrillation, if you will give beta blockers to the patient, what could be the side effects?
Beta blocker, decrease the heart rate.
All right.
Mm, mask if he have diabetes mellitus may mask hypoglycemia symptoms,
Yes.
postural hypotension.
Yes.
What else?
Yes. It says that can even side effects could be like patient presents with depression, bronchospasm, sleep disorder,
Okay.
bradycardia, heart failure, etc. So
Okay.
these are the side effects of taking beta blockers.
Beta blocker.
Very good. Right. I think I have asked you all the questions.
Okay.
Yes, one question they can ask you in this one, they can give you an ECG and they can ask you to count how to calculate
Heart rate.
yes, heart rate with the
300
ECG.
at number of small square between Q and QRS RR interval.
Okay, RR interval. Very good. Then one question could be that why does the ECG has the heart rate different to the heart rate on the blood pressure cuff?
Because we the heart rate and cuff measure peripheral heart rate but we measure from the center from the heart in ECG.
Yes, yes, but then even the blood pressure, it's recording heart rate, but it cannot count the small squares which you could count on the ECG and
Yes.
calculate. So, right. Right. Yes, okay. I'm just going through if okay, there could it says in this stem that this possible duodenal ulcer, but what other differential diagnosis could there be of perforated viscus?
Perforated viscus.
Yes, in this age, 74 years old male. So
Maybe smoking,
no,
maybe
no.
cancer.
Okay, no. This is duodenal ulcer perforation. So what other things?
H. pylori infection.
Yes, all right. No. There could
Okay.
be ruptured diverticulum. There could be
Yeah, yes, yeah.
this sort of ischemic bowel, necrotizing enterocolitis,
Okay.
and there could be perforated. Yeah, this is the perforated duodenal
Or
ulcer
H.
anyway.
Okay.
Okay. If you'll do the chest X-ray, what would you see?
Air under diaphragm.
Very good. Very good. And yes, thank you.
Thank you.